my name is Andrea Green, PN student at Wilson State College, and today I'm going to be demonstrating a pediatric assessment. So I'm going to be entering the room of my client, and I will knock and provide privacy. So I've knocked and provided privacy, and I'm going to perform hand hygiene, and I'm going to introduce myself to the patient. So I'm going to say like, hi, my name is Andrea, I'm going to be your nurse today. And then I'm going to direct my questions towards the mom as the child is quite young. So while I'm questioning the mom, I'm going to ask her to confirm her child's name and date of birth for me. And the mom has said that it's Charlie Lippincott, which matches the wristband, as well as date of birth 3/24/13, which matches the wristband and what mom has told me. And this little girl can also tell me just her first name. So I'm going to grab some gloves, and while I'm putting on my gloves, I'm going to ask a health history from mom. I'm just going to ask past health history, past medical surgical history, past family history. If there's any chronic illnesses the child experiences, such as asthma, which the mom says no, as well as medications that the child may be taking, including a vitamin, as some parents sometimes forget that vitamins count as medications. So the mother has told me that little Charlie here is just taking a multivitamin, and other than that is very healthy as for past medical history. So I'm going to start with a general assessment. So I see that there are no dark circles under the child's eyes, and if they were, that would indicate a physiological illness, but this child looks pretty healthy so far. And then I'm also looking for signs of any pain the child may be experiencing, and Charlie here is playing with the stuffed animal right now, is alert and looks to have good motor skills. As well, they're not grimacing or guarding anything. Doesn't look like they're in any pain. So then I'm going to move on and ask Charlie to tell me her pain on the FACES pain scale. So I'll just ask her to point to what face she's feeling today. And Charlie is telling me that she is a smiley face today and that she has no pain. So that is good. And while I'm doing this with the child, I am building rapport with her. I can do this by asking her her favorite color, asking her what her favorite toy or game is. If they're school age, I can ask them if they're enjoying school, if they have certain classes that they like more. So now that I've done my general appearance of the child, and I've noticed that they're alert and they're very calm and relaxed, which the mother has informed me that is the child's normal behavior, is a very calm and relaxed child, I can move on to the rest of my assessment. So I'm going to start with vital signs. I'm going to let Charlie play with the thermometer and my stethoscope as well. And the temperature we will be taking as per doctor's orders, and the doctor has ordered a tympanic temperature. So I'm going to let Charlie try it either on me or on mom on how to take a temperature so she gets comfortable with the thermometer. And when taking a child's temperature, because this child is older than 3, I'm going to pull the pin up and back. If she were younger than 3, I would pull it down and back. But in this case, up and back, and take the temperature. And I see that the temperature is within normal limits. If it was over 100.4, that would be considered a fever. And then next, I'm going to take Charlie's oxygen saturation. So I've showed her the little machine, and I've placed it on her finger. And while it's taking her O2 stats, I'm just going to check her cap refills while I'm already kind of around her fingers. And both of bilaterally, they're both less than 2 seconds, which is good. And her SpO2 stat is 98, which is perfect. We don't want anything lower than 92. And now I'm going to move on. So Charlie's been playing with my stethoscope, and I'm going to move on now to the heart as well. I've been watching the respirations as I've been building my rapport with this child. We watch respirations for a full minute in children, as they can be irregular, which is normal to be irregular in children. And we want them around 20 to 22 breaths per minute. And Charlie's sitting at about 21 breaths per minute. So now I'm going to listen to the heart, and I'm going to take the apical pulse rate. As in children, we want the apical pulse rate. So I'm just going to inform Charlie that I do have to go underneath her gown and make sure that she is comfortable before I begin this. So I'm just going to go at the fifth intercostal at the mid-clavicular line and listen to her apical heart rate for 1 minute. So then after I've listened for a minute, Charlie's heart rate was 100 beats per minute, which is perfect. And while doing this, I'm still building my rapport with the child, gaining that trust, and conversing with the mother as well. And then lastly, for vitals, I'm going to do a blood pressure. So I've let Charlie play with the blood pressure cuff as well, kind of showed her how it works so she's comfortable with it. And for a blood pressure cuff, we want it 2/3 of the width of the child's arm. So now that I have done all of my vital signs, including the pain, I'm going to get Charlie to go over to the height and weight scale, and we're going to measure her height and weight. And while she's going there and coming back from the scale, I'm watching her gait, which is steady. She's skipping, so she looks strong. Overall, a really steady and good gait. And then when she comes back from the bed, I'm going to plot the height and weight measurements on a growth chart to make sure her growth is on track, and translate any of the calculations to pounds or feet and inches, something that the parents would understand better, so they know where their child is at. So now that I'm finished with that, I'm going to start kind of more of my head to toe assessment. So I'm going to start with neuro. Since there is no order for neuro, I don't need to look at Perla or anything like that. And same goes for ears, nose, throat, and eyes. There's no order, although I can see in the mouth and I can see the mucous membranes are pink, which is good. The throat, I can see the trachea is midline, and everything looks symmetrical, which is really good. So now we're going to move on to the lungs. So again, I'm going to listen to the lung sounds, and I'm making sure that Charlie is comfortable with this during the procedure, and that if she wants to play with my stethoscope more or show her on myself or mom how to listen to lungs and the heart, I will do so. So I'm going to listen to her lungs, and she knows now that I have to go underneath her gown again, and I'm going to go from side to side, and each time I'm going to ask her to take a deep breath, and then down and side to side and down, so that I'm listening to all 8 of them, so that I'm listening to them bilaterally, making sure that they are equal. And then I'm going to get Charlie to sit up for me. So Charlie's going to sit up, and I'm going to listen at the back as well, which is the same kind of pattern, and every time taking a deep breath, and over here as well. So then after listening to the lung sounds, I don't hear any wheezing or stridor. I hear clear lung sounds, which is good. So then I'm going to move on to the heart. So again, I've let Charlie know that I have to go under a gown one more time and just listen to her heart. And I'm going to listen in all 5 spots. So over here. So after listening all 5 spots, I want to make any note of a murmur. Even if the mom has said the murmur's been present beforehand, I still want to document and report that, although Charlie here doesn't have a murmur. And then I'm going to do brachial pulses and make sure that they're strong and equal bilaterally, which they are. And then I'm going to check the fingers for any clubbing. And I already did my cap refills on the fingers, which were less than 2 seconds, and there's no clubbing present on either of the hands. So then I'm going to move down to Charlie's abdomen, and I've informed her I have to lift up her gown a little bit, but I'm going to keep her covered. And then all while doing so, I'm going to explain the procedure both to Charlie and her mom so that they're both comfortable. And first I'm going to look at the stomach and make sure the skin integrity is good. And while doing this assessment, I am also looking for signs and symptoms of abuse, which include burn marks or various bruises at different healing stages, which none of these are present so far. So I'm just going to look at the abdomen first, and then I'm going to tell Charlie that I'm going to listen to her tummy, and I want to make sure there's bowel sounds in all 4 quadrants. So then after hearing bowel sounds in all 4 quadrants, I can move on to light palpation. So I'm just going to let Charlie know that I'm going to press on her tummy a bit and to let me know if it hurts at all. So I'm going to press just a little bit, just lightly, but not too lightly to tickle the child, as that may make them uncomfortable or defensive. So after that, everything, palpation was normal. So I'm going to pull Charlie's gown back down. And while doing the stomach, I'm going to ask the mother about bowel habits, if they've been normal and regular, as well as intake. And the mom says that Charlie's bowel habits are normal. They're very regular. And Charlie here eats quite a lot of food and is very good with her intake. So then I'm going to move to the lower extremities. And I'm going to check her cap refills on her toes. And both of them are less than 2 seconds, which is good. And then I'll do pedal pulses, and I want to make sure they're strong and equal bilaterally as well. And again, I'm still looking for those signs and symptoms of possible abuse, which I don't notice any. So then lastly, for the genitalia, Charlie here is going to have a bath later today, and her mom is going to help her. So I just informed both of them that I will be peeking in the room just to take a look, making sure that there's no redness, rashes, edema, anything abnormal with the genitalia. As well, I want to ask the mom if there's been any bedwetting lately or more accidents than usual. And then, so I've done the genitalia, so I will do that when Charlie has a bath here, and the mom informs me that Charlie hasn't been bedwetting, which is good. So then concerning special needs, Charlie here doesn't have any special needs, so I have no special considerations for her today. And then for safety, I want to make sure the bed is in the lowest position with all the side rails up. The collate with mom or with Charlie, depending on the child's age. Charlie's pretty alert and smart, so she may be able to call if she needs help, as well as no cords hanging around the child or any small items that they could grasp and pull on. And then because Charlie is under the age of 13, if mom or another parent has to leave the room ever, we need someone to come in and sit with Charlie. If she were over 13, then we would just have continuous monitoring of Charlie. And as well, if Charlie was around that age of 9, I would start asking about menstruation, but since Charlie is pretty young, we don't need to ask about that quite yet. So then I've gone over the safety considerations, put the bed down, rails up, call light, and then I'm going to go back and document. But before I leave, I want to make sure that the mom and Charlie don't have any questions or concerns before I go, or don't need anything. So then they don't need anything, so I'm going to leave the room, do hand hygiene, and I'm going to go and document my findings.